Begin recording. Hi, everyone. Welcome to our presentation today. This is how to use your health coverage, brought to you by the Maryland Insurance Administration in partnership with the Maryland Health Connection. Thank you for joining us today, and we do hope that you find this presentation helpful. My name is Patty Dorn, and I'm with the Maryland Insurance Administration. I'm going to be the moderator and a speaker for this event today. You're likely here because you purchased a plan from the Maryland Health Connection recently during open enrollment, and if so, you are definitely in the right place. We're going to talk to you about the basics of the plans. We're going to teach you a few insurance terms, and we're going to show you what to do if you have a problem with your health insurance plan. A few housekeeping tips. This presentation is being recorded. It's going to be posted on the Maryland Insurance Administration's webpage. Please keep your microphone on mute and keep cameras off if you don't mind. The presenters will speak for about 30 minutes, and then we're going to have a Q&A for the remainder of the hour. So about 30 minutes of us talking, and then about 30 minutes for you to ask your questions. You can enter your questions into the chat at any time during the presentation. So with that, that's all I have, and I am going to hand this off to Jenny Garrison from the Maryland Health Connection. She is going to be our first speaker. Welcome, Jenny.
Thanks, Patty, and welcome everyone. Good afternoon. We are very excited to have you today. And I also wanted to let you know that I'm going to share my email address with you, and we're going to also have a chat or a Q&A at the end. So if you have any questions, feel free to add your questions in the chat, and we'll try to answer them. And I'm going to also share my information so that you can reach out to me as well. All right, let's cruise on through this presentation. Our key goal today is to just give you a little bit more knowledge around your health insurance plan, and also make sure that you have the resources that you need so you know where to go if you do have a question or concern. I'll try to talk a little louder here. I see some sound comments. Can everybody hear me okay? A little bit? Okay. And we're going to go over, thank you. Today we're going to discuss our top health coverage benefits that are included with all plans and how to use them. We'll also talk about the key costs and how that impacts your wallet. And as I mentioned, we want you to know where to go to get more information. So we'll share some resources with you. All right, so today we're going to talk about, I see a comment in chat, does this count for Medicaid as well? This is primarily about the private plan enrollments that you have. So if you picked a private plan, also known as a qualified health plan, we're going to talk mostly about that. And we're happy to answer some questions that you might have about your Medicaid coverage as well. So the first thing that you want to do once you get your insurance plan is to make sure that you pay your bill. So you should get a notice from your insurance company. Here's our first key health insurance term, which is a premium. A premium is sort of that health insurance term for your monthly payment. So you can see the phone numbers for the insurance companies that participate in the Maryland Health Benefit Exchange. And so if you haven't gotten a bill or you have questions about your bill, you want to call your insurance company to make that payment. Similarly, you want to make that payment every month. Your insurance company can cancel your coverage if you do not pay your health insurance bill. So it is important that you keep that paid up. Okay. The next important thing you want to do is to start to use your coverage and find a provider. A provider is a doctor, a nurse, or a licensed medical professional. We have a top tip here that if you work with in-network providers, in-network means that the doctor or nurse or medical professional that you're working with also works with your insurance company. So that means they're in-network, and you will save money if you work with in-network providers that work with your insurance company versus working with doctors who do not accept your insurance company. So how do you know if they're in network or out of network? There's a couple ways that you can find out. If you have a doctor that you're used to working with and you want to know if they take your plan, then you would call that doctor and say, "This is my new insurance plan. Do you take it?" And they'll let you know. Or if you don't have a doctor or a provider, you can call the insurance company that you've selected and they will help you find a provider. Similarly, Maryland Health Connection, we also have a tool at our website, marylandhealthconnection.gov. When you click on the after you enroll dropdown, there's a provider search tool that you can click on. And we do always recommend that once you find that provider from the search that you double check, make sure that you're then contacting the provider and your insurance company to make sure that they are compatible. All right, so you've paid your bill, you're looking for your doctors, and now let's talk about the coverage that you have. All plans sold through Maryland Health Connection provide the same core benefits, and we'll go through what those core benefits are together in 1 minute. And also what Maryland Health Connection also covers is preventive services that are free. And I'll also talk more in depth about that. But it is very important to know that you have health insurance now and you can access quite a number of services for free even before you make your monthly payments. Why are these covered services offered for free? Because we know that regular checkups and screenings will help you detect problems early, and that when you continue to go and get these routine screenings, ultimately research shows that you will live a longer life because you've had the preventive care. All right, let's talk a little bit more in depth about that. So what are the core benefits that are covered with all health insurance plans? As you can see on the screen, the most important things that you need for yourself and your health are going to be covered by your care. These are called essential core benefits or core benefits: preventive care, mental health care, doctor's visits, hospitalizations, maternity and newborn care, pediatric care, prescription drugs, laboratory tests, emergency care, and substance use disorder treatment is also covered. And there's even more covered. And the full list is available on our website at marylandhealthconnection.gov /health coverage, choose a plan. So if you're really looking for the nitty gritty, you have a specific service you want to make sure is covered, check out our website. And also you can contact your insurance plan to get a better sense of that specific service and what you might have to pay for it. So those are the core benefits covered with all of your plans. And then here's some examples of the free preventive services that you can access before you make that monthly premium. So this would include screenings for things like depression, domestic violence, blood pressure, cholesterol, diabetes, obesity, childhood and adolescent development, and more. And also free vaccines for children from birth to age 18 years old. And some vaccines are also offered for free for adults. Our annual Well Woman visit is free, which also includes a comprehensive physical exam. Your Well Baby and Well Child visits are free. I also have 2 young children, so I feel like I take them to the doctor pretty routinely, pretty often. And so it is really nice to know that when I take them for that checkup every year, that is covered for free, and I don't have to pay any more out of pocket for that Well Child visit. Again, we have a full list of all the preventive services that are included on our website. I would definitely encourage you to check it out, especially if you're looking for a service that you need. All right, let's talk plan costs. So this is where we're going to go into some key health insurance terminology, and feel free to add any questions you might have about this in chat, and we'll try to get your questions answered. But the first one we talked about, the premium. This is your monthly bill that you're going to pay for your health insurance. It's called a premium. And as I mentioned, you want to stay on time with your payments so that you don't have any break in your coverage. You want to keep your coverage and make your monthly payment, your monthly premium. A copay is what you pay at a doctor's visit that is not covered by your insurance, and it's a set amount. So I mentioned my small children, when they go for their well visit, their visit is free. But if they get sick, then I pay a monthly copayment, which is actually a $15 copayment for a sick visit. And usually when you see a primary care doctor versus a specialist, you have a different copay. So for example, I see a specialist for myself, and my copay is actually $30 for a specialist versus the primary care for my children is $15. So you will see different copays depending on the type of provider, but it's always going to be a set amount. And so let's say that you go to a doctor every month or every week, and you know that you're going to have a copay for that visit. You can take a look at the paperwork from your doctor's office, or I'm sorry, from your insurance company, or take a look at your insurance card, and that's where you'll find what your copays will be for the services that you need. So you can kind of plan your budget based on how, your copays and how many visits you're going to have. I see my colleague Teresa is adding some of the links in the chat for you to click on as well. So thank you, Teresa, for doing that and sharing some of these links with folks. So you can click on them and open that browser in your phone or on your laptop, wherever you're watching the webinar. So that's your copay. Again, it's a set amount, and your co-insurance is going to be calculated as a percentage. So co-insurance, this is a newer term that I've learned myself recently. And we see co-insurance a lot for when you are getting a medical procedure, for example. So you might have to get a procedure at the hospital, and then when you sit down and look at your insurance company, they'll say, we're going to cover, this is just an example, but we'll cover, for example, 80% of the procedure, and your co-insurance, what you're responsible for, is going to be calculated as a percentage. So the insurance company says they're going to pay 80% of the cost of that service or procedure, then you're going to be required to cover the other 20% of that procedure. And that's called a co-insurance. And again, you can find the amounts that you'll face listed either on the back of your insurance card or in the paperwork that details the information from your insurance company. All right, let's move on to our next cost. You have a deductible. A deductible is the amount that you owe for covered healthcare services before your health insurance or plans begin to pay. So depending on the plan that you've selected, you might have a $0 deductible, or you might have a $1,000 deductible. It depends on the insurance plan that you've selected for yourself. But before your insurance company is going to start to kick in and pay for your care, you have to meet your deductible. It's kind of like car insurance. You get in an accident, you have a $500 deductible, but you need $5,000 worth of work on your car. You pay that first $500, and then your insurance covers the last $4,500. So you meet your deductible before your insurance company kicks in. But keep in mind that those preventive services that we talked about, those are still going to be free before you meet your deductible. Let's talk about annual out-of-pocket maximum. I think this is, I like to think of it in a more positive way, because we've talked about a lot of other payments that you have to make for your insurance company for your coverage. But it is good to know that there is an annual out-of-pocket maximum that you would be required to put out of pocket every year. And again, this is going to be listed in the paperwork that you receive from your insurance company. But if you're keeping track of your budget, as I know all of us are right now with these tight times, you want to know what your annual out-of-pocket maximum is, so that once you've reached that, you're not putting out any more money for your insurance plan. So let's say you've met your deductible and you've made some co-insurance payments, which is that percentage for some procedures, and you've spent what seems like a lot of money, then you want to make sure that you're not going over that out-of-pocket maximum that you should be putting out. All right. I hope that's helpful to understand a little bit more about some of those key terms. And then this is a little tip. I know most of you have recently selected your plans. But when you are looking at plans, we do like to let people know that if you pick a silver plan, you can get extra cost savings through cost sharing reductions, which will help reduce some of your out of pocket costs like deductibles and copays. But essentially, the lower your monthly payment is, you're looking at higher out of pocket costs versus when you have a higher monthly payment, you're putting more every month into your plan, so you'll have lower out of pocket costs. But when you look at that silver level, it's a little more balanced. You have a average monthly payment and average out of pocket costs. So think about that as you go through the year and you're using your plan, maybe for the first time, if it's not working for you or you're looking for something else. You can always switch during next open enrollment. All right, let's look at the next one. Also, again, I know you just picked your plan, but as you use it through the year, value plans have been designed to offer lower deductibles and useful coverage for more healthcare services before you meet your deductible. And they're designed to lower your out-of-pocket costs for the healthcare services that most people use frequently. So this is something else you could check out. And also there's some plans that are even designed for certain illnesses. For example, we have a value plan around diabetes management. So if you or someone you know is going to be using more of the supplies that you need to manage your diabetes, there are value plans that cover those supplies and help you lower your out-of-pocket costs. So that's another tip you can think about as you go through the year with your current plan, and hopefully it works for you. And where to go for more information. So I know we kind of just touched the surface of the health insurance terms and information, but we are here to support you. We have a number of ways that you can get to us. You can chat with an expert on our website. We also have a virtual assistant as well as live assistants that help answer questions online. We work with health insurance brokers across the state who are trained and certified through Maryland Health Connection to offer you unbiased information about plan selection. They'll call you within 30 minutes if you fill out the Broker Connect form on our website. And we also have a free grant funded in-person assistance program where in every county in Baltimore City, we have healthcare navigators that are more than happy to sit down with you and talk to you about your plans and help you understand your costs and your coverage as well. And so all of those offices are listed on our website at marylandhealthconnection.gov/find help. Our healthcare navigators are also, many of them are bilingual, and so they're happy to help you even if you speak a different language other than English as your first language. Additionally, we have a call center that offers help in more than 200 languages, and we use relay service for those who have hearing impairment. So hopefully you can reach out to us to get help. And this is my email address. I'm going to add it in chat as well. If you're having an issue or you have a question, you can always send me an email and I will do my best to help you or get you where you need to go. All right. I think that wraps it up for me. I'm going to turn it back over to you, Patty. And thank you all again very much for joining us. And I wish you a wonderful year this year as well.
Thanks, Jenny. So lots of questions in the chat. And for the most part, we'll start to answer those questions once we get to the Q&A. There's a couple people from the MIA that are answering certain questions, but most of them we're going to address once I am done with my part here. So I'm going to talk about, this is part 2, and I'm going to talk about what you do if something goes wrong. So if you have a problem with the health insurance plan. Next slide. That's my email address. All right, real quick. Who are we? The Maryland Insurance Administration. We are the insurance regulator for the state of Maryland. What that means is that we're the entity that licenses the insurance companies and the insurance producers. The insurance producers are your agents and your brokers. We examine their business practices to make sure that they comply with Maryland law as well as federal law. So any plan that's issued from the Maryland Health Connection has been reviewed by the Maryland Insurance Administration to make sure that it follows the law. We monitor the solvency of insurers. We're the entity that makes sure that those insurance companies that operate in Maryland, sell you insurance policies, pay your claims, that they have money to stay in business. That's solvency. And it's not just health insurance for us, it's auto insurance, homeowners insurance, it's all kinds of insurance. So we approve those policies within our office. We review the insurance rates to ensure that they're not inadequate. An insurance company needs to collect enough money to stay in business, but they're also not excessive or unfairly discriminatory. The rates for the products that you purchase, for the health plans that you purchase from the Maryland Health Connection, have been reviewed in our office. And we also investigate consumer and provider complaints and allegations of insurance fraud. Next slide. So types of complaints that we can review. In general, we review complaints involving health benefit plans delivered or issued in Maryland. You bought your plan from the Maryland Health Connection, it is delivered and issued in Maryland. This can be for claim denials based on medical necessity, meaning my doctor says, my provider says, I need this medication. My provider says, I need this service, but the insurance company says no. So that's a claim denial based on medical necessity. It can be reviewed in our office, as well as denials of all or part of a claim for other reasons. Appeals of the carrier's denial. So you've already appealed to your carrier once. Your insurance company said no. Then they said no again. You can come to our office for another review, as well as other possible violations of Maryland insurance law. You thought this is supposed to be covered by law, and my insurance company is telling me that it's not. You can come to the Maryland Insurance Administration with all of those issues. In addition, if you were approved by the insurance company for a lower level of care than you asked for, if you believe the in-network or approved provider is too far away or the wait is too long, I don't have a car, 40 miles isn't going to work for me, or I don't have 60 days to wait for this next appointment, as well as you received an approval for fewer visits than your provider, than your doctor or your specialist thinks that you need. Next slide. So the denials, there's two types of denials. A claim denial. This is where your carrier or HMO, your insurance company, has denied payment for a service or medication that was provided. But there's also an authorization denial. So this is when a medication or a treatment requires a referral or a prior authorization, and that has been denied. Next slide. And I just want to stop at just for a second and say, I'm introducing a few new terms in this. And it's great if you take as much as you possibly can out of this presentation and this information. But ultimately, just remember that you can call us, the Maryland Insurance Administration, when you have a problem with your plan, you have a claim denial, you have an authorization denial, and you don't know where to go. So medical necessity, if your healthcare provider tells you that a certain service is needed, your doctor says you need this, it is medically necessary, but the insurance company denies it. That's a denial based on medical necessity. You have the right to appeal this decision. In general, you appeal this decision first to your own insurance company. So first you go to them, and usually your provider will help you with this appeal. They'll write up why you need this medication, for example. And that's your first level. You appeal to them. If you're denied again, you come to the Maryland Insurance Administration. However, in some cases, when you have a compelling reason, you can file a complaint with us first. So if you feel like it's an emergency, you can call us, you can call our 24/7 line, and we will tell you whether or not you have to file an appeal internally or if you can go straight to us. Next slide. You can file the complaint online. That's what most people do. That is, in general, the easiest. But you can also snail mail it in if that's what works for you, and you can fax it in. This has a link to our complaint form and the address there as well. Next slide. Our online complaint portal. There's also a video. If you get stuck, we have a video to help you with the online complaint portal, but for the most part, it's pretty straightforward. If you have a disability and need to file a complaint by phone, you can call the MIA at our 410-468-2244 number. For the most part, we do need to get your signature at some point in the process, but if you have a compelling reason that you can't file the complaint yourself, we will take it over the phone. The patient's signed consent is required for appeals and grievance complaints. So for a lot of our complaints, we are going to eventually need a signature. Next slide. So 24/7 for emergency appeals for medical necessity. This is medically necessary. I need this, and my insurance company has said no. Maybe they've said no twice, but maybe they've only said no once. You can always call our 24/7 medical necessity and emergency appeals line, and it's 24/7. It's all night. It's Saturdays and Sundays. There's always someone on call. They will either take your appeal, they'll take your complaint essentially over the phone, or if they say that you're in a situation where you need to appeal internally first, they're going to give you that information as well. That's 1-800-492-6116. So you use that number if you have a medical necessity appeal. I need this service. I need this medication. I need this procedure. My insurance company says no. Next slide. So what you should expect as part of our complaint process, you receive an acknowledgement of the complaint within a few days, and you're going to get the contact information for your investigator. And that happens really quick. It can happen the next day. You've got that investigator's name, so now you know that you have somebody that you can call and talk to. You can call your investigator anytime you have questions. The life and health contract complaints can take between 30 and 90 days to resolve. When the Maryland Insurance Administration first takes your complaint to the insurance company, the law allows them 15 business days to respond. Most of them respond quicker. It can depend on the complexity of the issue as well, but you should just know that the law allows them 15 business days to respond. That gets into the 30 to 90 days because every time we come back to them, the clock starts over. They have another 15 business days. Again, most of the time it doesn't take that whole 15 business days, but that's just so you understand if you feel like, oh my gosh, this is taking so long. The appeals and grievance, medical necessity. I know there's a lot of confusing terms. I just want you to know that you call the MIA if you have a denial, if you're frustrated with something where your insurance company is telling you no. So the medical necessity complaints are concluded in 45 days unless they occasionally ask for an extension of 30 days for more complicated situations. Next slide. These are just some videos. So if you get your, if you want the slides, you can watch our videos on appealing a denial of services, medical necessity and emergency appeals, mental health parity, mental health, your mental health equals your physical health, should be treated the same by your insurance company. And we also have a video on provider networks. So those are those doctors that are in your network. Next slide. All right, I wanted to wrap that up kind of quickly because this is a big group and I know you might have a lot of questions. So I'm going to encourage you to put the questions in the chat. I'm going to start from the top. And the other thing that I'm going to say is this: we only have 25 minutes left, and we still have 167 people on. Um, so we might not get to everyone's questions. What I'm going to do is I'm going to put the form to the Maryland Insurance Administration Health Coverage Assistance Team. So I'm with the Health Coverage Assistance Team. I'm the Health Insurance Administrator. What we do is we answer your your health insurance related questions. So if we do not get to your question today, I highly encourage you to fill out this form. If it makes sense for us to send it to the Maryland Health Connection, that's what we're going to do. If it makes sense for one of our specialists to answer the question, somebody will be reaching out to you in 1 to 2 business days. So I'm going to put that information in the chat right now to that link, and I encourage you to use it if we don't get to your question today. Also, if you have a really specific question, um, I'm gonna ask you to fill out the form because it's really difficult for us to answer a question about your specific policy, your specific situation without that information in front of us. So with that, myself and Jenny, and also at times I think Nick Cooper is gonna chime in to answer any questions that you have. All right, so we did have, will a recording be available? Yes, the session is being recorded, and we will be posting this on the Maryland Insurance Administration's website. And somebody asked, how do you know if you have health insurance benefits? And Teresa said, if you enrolled in the Maryland Health Connection during open enrollment, November 1st through January 15th, you should have received a letter with your carrier's information. Natasha asked if this includes dental. As you can see, we didn't go too much into dental insurance. If you have questions, I encourage you to fill out the HCAT form and we will get back to you regarding any dental questions. It might be the Maryland Health Connection if it makes sense to be with them or with us, the Maryland Insurance Administration. Um, Someone asked, my mother has been approved for community medical assistance, but providers don't know what that is. Can someone answer that question?
If if your mom was approved for medical assistance, but providers don't know what that is, then it's likely that the provider that you're speaking with doesn't participate with medical assistance. And so in that case, it sounds like you might have to find some new providers that work with medical assistance. Kind of like we talked about in network and out of network providers. Some providers don't accept medical assistance and some do. And so I would recommend that when you get when you've selected the managed care organization for your mom, which is what you select when you have medical assistance. It's called an MCO. It's kind of like an insurance company, but because it participates in the medical assistance program, then it's called a managed care organization. And so you want to contact that managed care organization with your mom and make sure that and work with them to help you find the new providers that she needs. Depending on what kind of provider it is, there are providers that do accept medical assistance. And so you want to work with the MCO and the medical assistants to make sure that you're looking for the providers that participate with her new plan.
Thanks, Jenny.
Mhm.
It, someone put a comment in about needing help with dentures. It looks like Ruth replied to that with the form. I would say the exact same thing. For that assistance, if you can please fill out the HCAT form and we will get someone to help you with that. Tavon asked, how do you know if you've been approved for medical assistance? I will let Jenny or Nick answer that question.
All right, I can take it on. So if you apply for medical assistance, the best way to see if you were to approve is to reach back out to where you applied from. They'll be able to tell you if your application was approved or if you need additional documents to submit with your application as well.
Thanks, Nick. Natasha said, I have Medicare and was only able to enroll for dental coverage. In most cases, that makes sense. You have Medicare with a supplement, and then you would use the Maryland Health Connection to apply or enroll in dental coverage.
Right. So Maryland Health Connection, just building on that, we offer something called standalone dental plans. So sometimes we see people who have medical assistance or Medicare and they want a secondary coverage for their dental, or maybe you just want dental insurance. You can do that. You can purchase a dental plan through Maryland Health Connection. I think I added the link in chat, but I'll add the link again where you can get more information. And I do believe that you can enroll in dental plans year round. So let me drop this link in the chat for you to take a look at that. Oh.
Thanks, Jenny.
Mm-hmm.
Elisa said, in general, if I'm hospitalized and the facility requests payment from my insurance company for an inpatient hospital stay, but my insurer reviews the admission and downgrades the visit to observation/outpatient stay rate, am I responsible for paying the difference between those two rates to the facility? I don't know if Jenny can speak to this more, but you would be responsible for what your out-of-pocket expenses are based on your status in most situations. And I'm not sure if anyone else has any more comment on that question. Elisa, if you still have more questions about this, please fill out the form and I'll have a specialist get in touch with you. Someone says, I have insurance, but they are instead accepting to cover only 20% of my prescription. You might want to fill out the form for that question because I think it's going to be hard for us to answer it in this forum without more detail. Iva says emergency room bills are paid after the deductible. Yeah, for the most part, you do have to meet your deductible. Does anyone have any other comments about emergency room charges?
I think it's a good time to remind everyone that you cannot be denied healthcare if you present to the emergency room. So if it's just a good reminder that the emergency room cannot deny you coverage. If you have healthcare that you want to use to cover that visit, then yes, you would meet your deductible before your insurance company pays for the emergency room visit. And you may still face a copay or a co-insurance for the visit as well. I took my mom to the emergency room a few months ago, and she told me that she got a bill for the emergency room visit, and she had already met her deductible, but she still got a bill for the visit. So your insurance company will pay, and that's where you want to understand that co-insurance or copay and look at the fine print of your plan from your insurance company so that you know what your expenses are going to be when you use some of those services. The costs really vary specifically by the plan that you've selected.
Jenny? Do I need a referral from my PCP to see a mental health provider? So that answer is going to be that depends on your insurance plan, and call your insurance company to see if you need a referral for that situation. I have several medications that I've been on for months that I had to get prior authorizations for because they are specialty. How can I get those covered? So for the most part, it looks like if your prior authorization was approved, then they should be covered. However, if you're still having issues with that, please submit an inquiry to us. What is the link for cost sharing reductions, please? It looks like Teresa put that link in there. Please see this link if you're eligible for cost sharing reductions. So those of you who are interested in seeing if you, I'm gonna give this over to Jenny to speak more about the cost sharing reductions because I myself don't know where they fall into this process.
So I'm sorry, can you repeat the initial question? I'm trying to find it, but I can't see it. Cost sharing reductions
So
and
yeah, what they asked for the link for cost sharing
oh, okay.
reductions. So I guess,
think that
I mean, a question. Yeah, go ahead.
I think that came up when we were talking about silver level plans. The recommendation is that um, we recommend you look at silver level plans because you can get more cost sharing reductions. So I'm trying to think about the best way to explain it. The Maryland Health Benefit Exchange is the official health insurance marketplace in Maryland. And so when you go through Maryland Health Connection, it's an income-based program. If you're a lower income person and then you may qualify for medical assistance. As your income gets a little bit higher, we offer you different types of financial help so that your plans aren't as expensive for you. So you have a lower deductible, lower premium. And this financial help is they're called cost sharing reductions. They're also called advanced premium tax credits. And there's another form called the young adult subsidy in Maryland. And so depending on your age and your income, the cost sharing, the financial assistance, including cost sharing reductions, is what the exchange is set up to help you, is how we're set up to lower your insurance payments. And so if you're feeling like you picked a plan that's too expensive, or maybe when you picked your plan, you said you weren't interested in financial help, you next year when you come in again in open enrollment, you want to say that you are interested in financial help, and then look at silver level plans, look at value plans, and make sure that you're picking a plan to get the financial help. A cost sharing reduction is to help you lower your payment every month so that your plan is more affordable. And the different types of financial assistance available are only available through Maryland Health Connection. So if you go right to an insurance company thinking you're going to get a better deal, you're probably not, because you're not going to be able to access those financial assistance that the exchange is set up to offer you. I don't know if that's helpful. Hopefully it is a little bit.
Thanks, Jenny. Yeah, I think that was helpful. I'm gonna actually open this link myself and see if it covers both kinds of cost sharing.
Wouldn't
I don't know. I think
information on cost
kind of
sharing reduction.
opening slowly. So Jose Luis said weight management coverage. I was told by my doctor they would be restructured after new president came aboard. So Jose, we can't really comment on that yet. We don't have any information about that. Should your PCP offer you the free preventative care benefits, or will I need to ask to receive them? I don't know, Jenny, if you have anything to say about that. Go ahead.
In my experience, for example, when I take my kids to their pediatrician, if the service that they receive is a preventive service, for example, I just took my youngest for his 3-year-old well visit. He's a big boy now. And so that was free. I did not receive a bill. They did not ask me for a copay. I did not get a bill for a co-insurance. That well visit was completely free. I didn't ask for it. It's just part of the insurance plan. This was a key provision that we have now because of the Affordable Care Act. And so my guess is, based on that experience, that you should have a similar experience when you go to your primary care doctor. Any service that they offer you as preventive, whether it's a vaccine that's covered for free, or if it's just a For example, when you go to your well woman visit, that well woman visit should also be free, and it includes, the breast exam, often the pap smear. You shouldn't have to ask for it, and you should be aware of what's covered for you for free, so that if you do get a bill, which you should not, that you're not paying that and you're calling to say, no, this is preventive care. But in my experience, the primary care providers know what they can and cannot bill you for, and they know that the free preventive care is covered.
Thanks, Jenny.
Yeah.
Jenny, can you talk about how Healthy Smiles works?
Healthy Smiles is the dental program that's covered through the medical assistance or Medicaid program. So if you are enrolled in medical assistance, then Healthy Smiles would be the dental provider that you would use. Depending on your age, your coverage is going to vary. My understanding is that dental coverage doesn't cover quite as much for adults as it does for children. So it's good for you to know what's going to be covered, and you can contact medical assistants or Healthy Smiles or your dental provider to get more information about what's specifically covered in your dental plan.
Thanks, Jenny. How far back can you go in date for complaints on denials? You have 4 months to file a complaint if you disagree with your health insurer's final decision. Jenny, if coverage is to start on 2/1/25, so February 1st, and you have not received an insurance card or a bill, is that something that a consumer should be concerned about? It looks like you
I guess
answered
it
that
is
actually.
January 20. Yeah. I would definitely recommend you contact your insurance company to make sure that it hasn't been some type of issue that why you haven't received your card, or just to get a better sense of when you'll receive it. And maybe you can make your payment on the phone so that your coverage starts on time. Yeah, I would definitely call. I would call the insurance company that you picked.
All right. So Therese asked how to find out what's covered by your plan and do they have a website for it. So when signing up for your health plan, Ruth says, you should have received a summary of benefits, and it's sometimes referred to as the explanation of benefits. And that details what is covered under your policy. And again, if you have more questions about this, submit an inquiry and we will assign your case to a specialist. Mary's having trouble finding a periodontist provider. Jenny included the provider search tool, which can help you find your provider. If someone hasn't received an insurance card for Medicaid, who do we recommend that they reach out to? I think Nick already answered this question, so apologies for it again.
You
said
can
if
call
they,
them. Oh, sorry. Go ahead, Nick.
if they didn't receive a card from Medicaid,
Right.
they can reach out to the Maryland Health Connection at the call center, and the call center will be able to order them a Medicaid card.
Perfect. Okay, great. So Hope asked how much are therapy sessions, and to Ruth's point here in the chat, it's going to depend on your individual policy. Who do you contact if there's a problem with the Maryland Health Connection customer service representative? You have a specific problem. You can fill out that inquiry form. Does this appeal process include medical assistance? That is a great question. And through the Maryland Insurance Administration, it does not include medical assistance. You can fill out the inquiry. We can get you the help that you need, but the Maryland Insurance Administration, we only have jurisdiction over insurance policies. And because medical assistance is essentially a Maryland state plan, it does not fall under our jurisdiction, so that appeals process does not apply to Medicaid. Dwight asks, where can I go if I'm planning to start a business and I want to provide health coverage for myself?
That's a great question. Maryland Health Connection has, it's called Maryland Health Connection for Small Business. And actually, the program manager for that, Teresa Battaglia, is on this call.
Hi,
I'll add
yes.
the, yeah, go
Hi,
ahead.
everyone. Hi, I'm Teresa, and I am the Small Business Outreach Manager. I'm going to put information in the chat for this particular person, consumer, just so that you know where to go. We do have a website, and it is mhcsmallbiz.marylandhealthconnection.gov. We can supply your employees with health insurance, and if you are eligible, you too can also get 2 years worth of tax credits towards the premiums that you place towards your employees. So I'd be happy to talk to you individually about that. I'll put my information in the chat as well as the website for you to browse.
Thanks, Teresa. Liz asks if a radiologist recommended a 6-month follow-up mammogram to check on a potential area of concern. Is it covered as a preventive service, or do I need to get direct approval from insurance? It's quite likely that this wouldn't be preventive at that point, Liz. And if you do have more questions, I encourage you to send in an inquiry. I don't know if you have any comments on that, Jenny.
I think my recommendation would be to, let's see, if she needs a mammogram every 6 months. I believe that mammograms are covered. Do I need direct approval from my insurance? I'm only 35 years old. I guess, again, from my personal experience, my doctor also recommended, due to my family history, that I get every 6 months screened for breast cancer. And so, because I haven't, I'm still in the process of this, but my recommendation and what I'm planning to do personally is to work with my provider to make sure that, it's in my record that that it's a medical necessity. And then if I'm not able to get it covered by my insurance, then I would probably contact the insurance administration to see if it's a medical necessity that you get the screening more than once a year. I'm honestly not sure, but I know that we're seeing more and more women of younger ages need more screenings because breast cancer has become so prevalent. So I would recommend that you work with your doctor and contact your insurance company to understand what your costs are going to be. It's something I need to do for myself as well.
Thanks, Jenny. Jenny, do you have to have your PCP on your insurance card?
That's a good question. I think it depends on your plan, right? Because some plans require that your primary care gives you a referral to a specialist, and some plans don't. I think it depends on the type of plan, but I would recommend you contact your specific insurance company about that.
Hope asks, is therapy session the same co-payment as medical appointments? So there's a federal law that requires that essentially your mental health be treated the same as your physical health. However, it can be very complicated in the way that it is applied. And so this would be a question that would likely be specific to your policy itself. And it is something that you can send in as an inquiry and we can look into it more. Leslie asked what dental and vision is provided, if any, and I'm guessing that she is referring to the QHP plans themselves. So Jenny, do they provide any dental or vision coverage?
I'm not sure. I think it depends on the plan that you picked. Again, I would recommend you contact your insurance company to get details. And as Ruth had put in, that explanation of benefits should have more information about that.
Thanks, Jenny.
What do you think, Patty?
Sounded good to me. I'm sorry that we're out of time. But again, I encourage everyone, if you still have a question, to go ahead and put that question in as an inquiry. I'm going to add it at the bottom of the chat right now. So it's sort of direct. It's right there. So you can grab it easily.
I'm going to answer one more question that I see from Zoe, which is, can I still apply? And you can apply for Medicaid any time of year. And right now there's a special enrollment period that you can activate by when you file your taxes. You check a box. It's actually 3 boxes on your taxes that says you don't have insurance and you're interested, and that you give us permission to look at your eligibility and send you a notice. This is called the Easy Enrollment Program, which is it's kind of like a second chance for you. If you check that box on your taxes when you file your taxes before April 15th, then we'll send you a letter and you can take that letter and apply for health coverage. But again, you can apply anytime for Medicaid, or to see if you're eligible for Medicaid, you can visit marylandhealthconnection.gov and apply that way.
Thanks, Jenny.
Yeah. I'm going to also add
And
my
Teresa put the link into the, yeah.
Sure. Thank you for having me, Patty.
All right. Well, yeah, Teresa, thanks for being here. Thanks, Nick, you too. And you, of course, Jenny. Thank you, everybody, for being here. You have that inquiry. We will get your questions answered, or we will get them to the Maryland Health Connection if that is the right place for you to be. And with that, I hope everyone has a great rest of your day. Did you have any last words, Jenny?
No, just feel free to reach out to me or to the HCAT team. We're happy to support.
Thanks.
Thank you.
Thanks all. Have a great day.